Hi again. This is Jacob. He's the newest member of the Northside team, and he'll take you on a tour of our clinic. So, here we go.
Cut. Do I have to go on?
She's the best vaccine giver. She gives me my flu shot every year. She's really good.
Team-based care provides integrated care before, during, and after a patient's visit. Come on in.
So working with the team, with a medical team, has really been helpful because we send and receive referrals to each other, and we are able to treat the patient as a whole with a one-stop visit.
I think all of the members of our team now see that they have an equal responsibility for providing care for that patient when they come in.
Our patients now know that they are in a certain team, and it has really helped us retain employees, it's helped us retain patients, and provide better patient care.
Team-based care has made me more aware there's more to an individual than just their medical issues that make them a whole person rather than just an ICD-10 or a diagnosis, and you get to learn more about who that individual is rather than just their disease.
I think patients that are able to access the Be Well Clinic feel more taken care of at the end of the day.
So Castle Pediatrics used to have a template full of a whole bunch of different appointments that could be scheduled at certain places. We decided to wipe all those out and not have a template anymore and just basically save some room for same day sick, and it seems to be working in a very positive way.
The positives are that parents can now schedule well checks and other appointments at times that are convenient for them instead of having set times where they have to do them. So it allows more flexibility for the patients, and it has increased satisfaction.
Team-based care is a mindset. It gives everyone who's involved with the patient care equal footing, and it breaks down the hierarchy. In doing so, the patients can have their needs met on multiple levels and in a more timely manner.
Good patient care consists of a whole team of people that are coming together to give the patient the best treatment plan possible. I envision it as the patient as the center of the treatment plan and incorporating doctors, medical assistants, nurses, everyone from the social worker to the pharmacy to the lab, and making sure everyone's included and there's continuity and collaboration between everyone.
So the days of somebody being able to just walk in and see a doctor and that's all they need, I think that's behind us, and we really need team-based care to make all of this happen for our patients.
Team-based care. It takes a team to make a difference.
I oftentimes get the comment that it's like one-stop shopping for them. We have the behavioral health care, we have the dental, we do have health navigation. We also have connected coverage, so if they are uninsured or are running into some difficulties there, we can help them with that as well.
Since we've been tracking our asthma patients and bringing them in for regular visits, it has allowed us to educate our patients better about their medications and has allowed them to have a better understanding about how their medications work and why they need to take them and why they need to take their preventative medications on a regular basis, and when to use their medications in more emergent situations.
Team-based care is about whole person care.
I've taken a lot more initiative, more roles, and than just answering phones and scheduling people, and it's really brought us closer together as a group.
Another thing that I've really been focusing on is our diabetic registry. I'm a champion for one of our teams, and I've been focusing a lot on getting our diabetics back in to get their diabetes under better control.
We all feel very comfortable that our patients' needs are being met and things aren't, falling through the cracks. So it is nice to have a set team and know who my team members are.
Team-based care helps us to develop a deeper understanding of our patients and their unique needs. We're able to care for them on a more personal level.
Through the team-based care initiative, every member of the Rio Grande team has learned about the fundamentals while also building a bit of friendly competition and just having fun.
A medical provider, we have behavioral health, we have health coaches, we have case managers, and they all work for that one patient.
Nursing, medical assistants, front desk, patient navigator, medical providers, behavioral health, and coordinated care. All of those key players that, when utilized in harmony and coordination, can make the patient's health much more smooth and with a better outcome.
Team-based care for me and my staff has brought us a lot closer. So one of the goals with the MAs was to try to get them more active in their role, more participation with the providers and within the clinic. And I feel that it's given them more of a voice so that they could be greater advocates for their patients and also for their teammates.
Team-based care bonds our patients and families to our practice.
What I'm most proud of is the connection between my coworkers and the patients. Everything is a lot more organized.
We've been able to develop standing orders, we've been able to redefine roles, and we've been able to really support our nursing staff in particular of taking on more and more clinical skills that they may not have been able to previously, and really make our workflow much more efficient and utilize the talents and strengths that our team brings to the table.
We've noticed a change in process. We've been able to sit and identify the proper way of going about creating a process so that the whole staff accepts the change, the staff learns the new change and is able to implement the new change without a lot of discord or confusion.
I think our staff have more satisfaction in their job. They feel more connected as a team. They're talking with the providers. They feel like they're making a difference. They're not just doing nominal tasks or entering data. They're actually impacting patient lives, which is satisfying.
Team-based care is
excellent patient care,
empanelment, continuity and access, communication and accountability,
happy patients, happy doctors, happy staff.
Team-based care helps us wrap services around our patients.
That was
Third time's a charm.